You're a little chilly.
Sorry.
Is this right? Who I'm holding?
Uh-huh. So you notice how when you guys are doing this,
You don't do it.
you're not having to switch your hands, like you get up to 90 degrees and then you switch and go. Do you notice that? And that's good. Don't do that. Because if your partner is, or if your patient is in pain and muscle guarding, you don't want to have to switch hands halfway through. Okay? That's not going to be a comfortable feeling for them. Okay. Abduction. We're going to start with the patient's arm at their side. I'm going to make her lead with her thumb, and I'm going to come all the way up and then back down. Okay, all the way up. Support again at the wrist and the elbow. All the way down.
Am I going too fast?
Okay, flexion and extension. I'm going to put my patient into 90 degrees of abduction. Okay, when you do passive range of motion, for the most part, you're always going to take them into abduction as much as they'll give you. So if she had surgery and this is all she gives me, I'm going to take what she can give me and then I'm going to do passive range of motion there. Okay? For our sakes right now, we're going to put them in 90 degrees of abduction, cup at the elbow, and then full range of motion.
Internal, external.
Oh,
Right.
what did I say?
Flexion.
Oh, internal, external rotation. Oh my gosh, I don't know what I'm talking about.
No.
Just a pinch right there?
Kind of.
Right here. You shaking? Probably. I had coffee this morning.
This is what, it's supposed to go more than this, right?
You'll kind of feel an end feel.
Okay.
Some people just don't have as much.
Go that way a lot.
Some of the girls yesterday, some of those volleyball players, Molly Paul, who also plays softball, she had a ton of external rotation, just a ton. Take them to what they have.
I just didn't want to.
Well.
Okay, horizontal ab and adduction. I'm going to come across and all the way out. Okay, so again, a hand on the wrist, a hand on the elbow. I kind of catch the elbow as I come across, catch the elbow as I come down.
Would you want the patient to move to the edge?
You could if you wanted to really get horizontal abduction. If they're in bed though, I probably wouldn't worry about it.
How was that? Was that hurt? You just keep going.
How many reps should you do?
Good question. Remember how many reps we do, passive range of motion? 5 to 10. I heard a 5 and I heard a 10.
Okay.
Yeah.
Okay, we're going to move down to the elbow. I'm going to cup the elbow with my other hand and make sure we do full range of motion. okay? You also could do this if you wanted to incorporate supination and pronation in and as you go. I could do this, pronate and supinate. All right, entirely up to you if you want to do that or not. Okay, supination and pronation occurs at the forearm, not at the wrist. So I'm going to come down on the forearm, supinate and pronate. Okay, then we come to the wrist. All right, here's where I had you make the note for tenodesis. Tenodesis means, you notice when I flex her, her fingers go straight. All right, and when I extend, the fingers flex. Okay, because there's a lot of various joint muscles and tendons that come across here. So as they cross here, they're coming into passive insufficiency. All right, and so we're going to let them do what they want. I wouldn't want to come in here and attempt to stretch these. They're there for a purpose. We do this for a purpose, okay? So I'm going to put my hands in the met head portion of her hand. So I'm right at these knuckles here on the inside, and then my thumb is on the outside. I hold the forearm, and I just let those fingers do what they want. Okay, again, the tenodesis.
Didn't even notice I went.
Okay, the deviations, I'm going to handshake and then deviate. Not really one that's done often, but just, I guess, so we cover it, make sure you know that it's available, the deviation. Okay, then going to the fingers. Normally, if your patient would be comatose, you wouldn't go through every individual finger joint on the whole hand. It'd take you forever. You don't have that much time. So we're going to do gross finger flexion extension. I just curl her fingers around mine. Notice I keep her wrist in neutral and I'm not doing this. Okay, I don't want to stretch those flexor tendons out in the fingers. Okay, I can hit the thumb then, do opposition. When you do opposition, you're kind of hitting all the abduction, flexion, and rotation component of the thumb. Okay, so you can hit all those real quick. But if you needed to go through individually, you hold proximal and you move distal. And you would go through each joint. Okay?
Wrist pops.
Yeah. Okay, so that is upper extremity, all right? I'm gonna have you guys switch around.